Hello. Leaving hospital and going home is a huge step in your journey towards recovery. However, when you are at home, you will not have the same support you had in hospital. It can be a difficult time of adjustment for you and your relatives. It is normal at times to feel low, depressed or frustrated by the things that you still can't do. It is sensible to try and get into a routine and set yourself realistic goals. This will help both your physical and psychological recovery. Setting goals can help you progress and show that you are improving. This will motivate you to continue on your recovery, even if steps are small at first. Suitable goals include something as simple as making a drink or walking a few steps further each day. Keep doing any exercises the physiotherapist gave you. It is important not to push yourself too hard though. Remember to give yourself time. Try not to bottle your feelings up. It can make you feel worse and have a negative impact on your health. You might find it helpful to talk your feelings over with people close to you, even though this may be upsetting. It is very important that you don't use alcohol or drugs to cope with painful memories or uncomfortable feelings. This will eventually make things worse. Some patients may need professional help or advice. We recommend that you see your GP if you have no one to share your feelings with, find your feelings overwhelming and difficult to tolerate, find that you are preoccupied by particular parts of your experience, and it is affecting your sense of well-being and ability to sleep. You're staying away from people, are not improving over a 6-week period, are drinking or smoking too much, or using drink or drugs to cope, or people around you suggest you seek help.
It's true. The recovery is not instant when you're discharged from hospital. The recovery goes on. Mine's certainly gone on for probably the 2 years that I was told it would do. Yeah. It's certainly not a thing that's going to go away in 3 months. And you shouldn't be under the impression that when you leave it's a marathon, not a sprint. It's just go with it, take your time. Don't over push it. I mean, you've still got to listen to medical advice because they still have the investment in you. It's up to you. If you get an infection, for instance, don't put up with the infection. Go and get it sorted, and get your flu jabs.
When I first came home, I do remember that one of the problems that I had was almost relinquishing control of Archie, kind of thing, because I still desperately wanted to be his dad, and I desperately wanted to still be able to nurture him and to kind of and to have the best things for him. But because of my brain condition, I was always overdoing things and feeling really anxious and about his welfare and what was happening to him, and I was constantly in my head thinking about things and churning things over.
I think it's quite a natural way, and I think not only for the patient but also for ourselves as the family members, to have that sort of heightened anxiety when anyone's ill. I mean, before Matt's critical care stay, like even hours before, he felt like he didn't seem any iller than he'd ever been before. So I think it does make you question your abilities to judge how ill someone is, and I think is a very normal feeling to have. And obviously what happened to Matt is extremely rare, so therefore you have to remind yourself.
You're going to have bad days, you're going to have tears, and it's going to be tough, but you just have to keep going, heading in the right direction, and
it's not
over yet for us, is it?
No.
It's not like we're sat here going, "Oh, it's all finished behind us now." It's still tough now, but it's okay. We're doing it, aren't we?
Okay, no.
I felt a bit isolated when I was discharged and went home. Although I was really grateful to get home, I felt nervous and frightened about leaving an environment with all the facilities of an acute hospital, and then suddenly it's like it's no longer there. And I know this feeling eases up a little bit once you leave the hospital and you go home. I remember, though, being so dependent on one friend. Back then, I couldn't really do anything for myself. I couldn't go shopping. I couldn't go for a walk. I couldn't meet people. I was a really outgoing person before all this, and back then I didn't really feel like myself. When I got my clinic letter, that was a huge relief. I realised that I wasn't the only one going through this and finding it so difficult. And it gave me hope.